health problems, to come over before coming them to the hospital. And then they rehabilitate such cases identified. Then they would give information to each family depending on the financial status to live healthy. It wouldn't mean that, the rich are the only people who can, live healthy. They went to address the gap of information, how to live healthy within your means. That was what they were doing. And that nurse worked very hard, and they worked hand in hand with the district officials in those years. Until the 1970s, where there was a global recognition of the district as the nucleus for needs identification, planning, coordination, integration, and monitoring of health programs, that it was then dictated by the country to train the public health nurse at a higher level, which then necessitated the training of this nurse at a diploma level. In 1976, in Mulago, the training started before we came here, because these were the key members of the district team. As they worked, they would quickly inform, there's an outbreak of disease like such here, that measles used to be so much. In their home visits, they would identify, when you have in the same locality about 5 people with the same symptoms and signs, then you quickly inform the district officials to have that handled. That is how they started public health in nursing training at the level of certificate in 1950s, and then it was dictated like in 1970, no, let's train them at a higher level to come and perform their duties better. They have been doing occupational therapy, they rehabilitate, they give nutritional information. They also sit in the families where they have found that there is domestic violence. They give information how you can live in harmony. When you live in harmony with your family, you are at peace. You can go and cultivate the gardens and get more food, and you eat very well. You don't visit the hospitals frequently, because if you eat well, your immunity will be boosted. And then they'll tell you, when you live in a harmony, if the wife is pregnant and cannot take the children for immunization, the husband yourself, you can do that. If you live in unity and in harmony, then the whole country will live at peace and live healthy, and you produce more. Okay. So they were actually cutting across. They would not only address health issues alone, and
they also offer counseling.
Yes, they would do that, and then they let you see spacing of the toilet, how far the latrine is supposed to be from the home because of flies. They talked about diseases spread by the house flies, diseases by the mosquitoes, how you must clean the environment. There should not be bushy areas in a surrounding. There should not be stagnant water bodies where the mosquitoes would breed and then later, bring for you malaria. Basically, that was their work, and it was enormous.
Okay. So yes. What makes a public health nurse different from the other nurses we hear about? What is that unique touch about the public health nurses?
They are the nurses who have the time to go and be in the community, live with them in their setting, and even then, as they demonstrate to you how you are to do the garden, you can quickly remove your shoes and then be in the gumboots and show the family this small piece of garden could make for you greens, which will let you not have anemia, and then to boost your immunity, because the vitamins in it, and then the iron factor of it, they will let you know that. They bring themselves to the low level in a way that there's not a gap that, oh, this is a nurse. So you find the community opens to them their problems very, very well, and you will actually know not only the health problem of the clients or the patients, you know them more than that, and they take you as part of their family. I think that's where they excel. They have more time to be in the setup of every client of theirs, yes. Be it a patient in that case or a client rehabilitated. They have more time to be with them, and they are trained to be working in the grassroots.
Okay.
Yes.
And also you talked about moving out there to different communities and
homes, yes.
to talk to different people.
Oh yes.
So how exactly do you collect and assess the data that you get out there, or do you carry out research?
The nurses in this institution actually, we would call ourselves a special grade, and the area we have specialized in is to be informative. We collect the information and analyze it, and then, and write about it. The information they collect, they always move and say, in this place, how many people are there? How many, this makes a number, it's now already opening eyes. They used to inform the district. The district has a data capturing of information, and quickly it informs there is an outbreak, there is this happening. So their information and the fact that they go village by village then makes a baseline information to see that there is, with the population this much, this many, if so many of them are already sick or have such a problem, then there must be intervention. They do that by writing it up, and we also do research here. They make information using IT, either by sharing this information with their immediate supervisors, the lineage of the district health visitors, the nursing officers and the DHOs, quickly online by WhatsApp group, or writing mails to them, as their research also is published to inform the public about the health issues they discover in their home visits, in their school health programs, as they go to the clinical area.
Okay. So as an institution, what are some of the programs you offer?
We do, as I said earlier, home visits. Our nearest home here is the Kinyarwanda village on the other side. Okay. They visit the homes one by one, and are followed by the faculty. As they learn, they are also giving healthcare education to the community. Like, cover food, boil water, and then to prevent waterborne diseases. How you must sleep under mosquito nets. There was rolling the mosquito nets, but you would give mosquito nets to people and they are not using it. So as they go to the villages to do that, they are giving support, supervision to the health ministry in prevention of health related challenges and diseases. Then in the institutions, many times, and the primary schools and secondary schools, the children come and they're in a bigger number than the higher institutions. They assess these children in the schools and help to diagnose diseases that even their parents would not have seen, because the children are like for 3 months or 4 in school. They are ever in the morning going and coming back in the evening. They spend most of the time in school, where the teachers have many of them. They cannot also see that. Then the parents, you have been looking for food, and you've been working, you've been either working in the garden, in the office, you come late, you interface with your own child for a short time. You cannot even have time to assess the child. And if the child is coughing, some of them will just give maybe some medication, and they don't have time to take the children to the hospital. But when our students go, or the public health nurses go to the community, then they see more and then sieve by, it's like triaging them. Which one of these have communicable diseases? Therefore, they must get interventional treatment immediately, or at a one time be isolated. There could be skin diseases. They give information also to the workers in the institution, in such institutions, and let their head teachers and teachers know. This is how this disease manifests, and it can multiply. What we do is, let's have all of them treated. Let's have the latrines well cleaned, because when they go, they don't assess the children and the environment where the teachers are teaching. They go to their washrooms, the toilets, and then talk to even the staff how to make them clean in the line of preventing diseases. And so is also in the communities where we go and do home visiting. You give them support. Sometimes you make a project in a home that you visited. You can make a raised place for washing plates, so that after washing, raise it up, it dries. The sun radiation can kill some of the microorganisms, because if you use the towels, some of them don't use the towels to dry well, they just get a wet one which had microorganisms. The sun radiation does it better. And then the channel, they show you the dirty water should be in this area so that it drains in the soak pit. It doesn't stagnate, in order to bring mosquito breeding areas. So is how they have been very useful addressing the health issues which would be overwhelming.
Okay. And also, how are the students being awarded after the completion of their studies?
The students at this level right now get an advanced diploma in public health nursing, and public service has the scheme of service to them at the level of U4 salary scale, which may not have taken place because of global financial challenges, but it's already a very attracting salary scale with the enhancement the head of state has given to the scientists. It's a very lucrative money monthly that they are going to get, which should actually attract many of them. I am urging to the public that a graduate of this institution gets a U4 scale, and that's a very good scale that should make us to have many of them. And given the work they do, we need them more in the community with the emerging diseases like, the COVID-19 that came. Now we have Ebola has come back again. These are the people who would be very much in the communities, like, what am I saying? The parish model, the way they have come. In every parish, there could be at least 2 of them, 2 public health nurses I would recommend, who will interface and interact with the community and, address healthy living all around for our citizens in Uganda. We train here for the 1 year. It's supposed to be either a psychiatric nurse or a pediatric nurse or a midwife at a diploma level, or then or a comprehensive nurse at a diploma level. We have scholarships for these courses of 1 year. The government is giving funding for that, so it even makes it very more attractive for many of the nurses out there to come and study. So through this interview, I'm calling many of you to come. We are soon having the interviews. You can please bring your applications to Public Health Nurses College here. You are most welcome. We are looking forward to training you.
All right, so we have heard from Betty, who is the principal for the Public Health Nurses College, and we get to realize that the roles of the public health nurses is way wider than we think, because they promote good hygiene, they promote good nutrition, and also provide counseling sessions. But there is so much we are yet to learn here at the Public Health College, and let's go and interact with some more different people. Stay tuned. All right, so on set with me right now are the members of the Public Health Nurses Association, and on my immediate left is Acham Ruth Ononge, who is a district health visitor Luwero, currently retired, but also a member of the Public Health Nurses Association Uganda. And next to her is Oluka Alungat Helen, the former senior principal nursing officer, that is of Moroto Regional Referral Hospital, and she is now the chairperson of the Public Health Nurses Association Uganda. Next to her is Grace Ojirot, the public health nurse, currently one of the directors of the Health Training Consultancy that trains in health workers' reproductive health. Welcome to the show.
Thank you.
All right. So, Oluka, why and when was this association created?
Thank you so much, moderator. I'm happy to be here. This is a great opportunity. I would like to thank UBC and as well as the training school for having invited us. We are here as members of Public Health Nurses Association and alumni. This association was started in 2019 and we have currently 100 registered members. However, in the Uganda Nurses and Midwives Council, the council that registers the professionals of nursing, we are 196. Why were we started this association? Because one of our mandate is to participate in exchange of information, ideas, and give advice to the Public Health Nurses College related to training numbers, adequate numbers of competent public health nurses who will give service, provide quality services to the population of Uganda. That is why we are advocating it. Yes.
And also, what is your mandate?
Yeah, the mandate is this one, to participate in exchange of information, ideas and advice on matters related to the training of adequate numbers competent in public health nursing who will provide quality services to the population of Uganda. That's why we are here. Okay. So we are acting as a support to the school, being alumni.
So Ruth, what are some of the roles of the public health nurse?
Thank you very much for that question. The role of the public health nurse is to focus on the prevention of illnesses, injury or disability, promotion of health, and maintenance of the health of the population. But I will break it down in areas. So this makes this cadre, the public health nurse, a special person because she's giving a specialized services. On the area of preventive care, we have the core, which is immunization. We immunize the young girls, we immunize the children under 5, and we immunize the girls with the tetanus toxoid to prevent tetanus. The younger girls, we immunize them against the hepatitis B with the hepatitis vaccine. And now the adults, we give them COVID-19 vaccination, we give hepatitis B vaccination, and we are moving on even to give the yellow fever vaccination. We also move on to immunization, onto antenatal care. In antenatal care, we give care to the pregnant mothers, but not only that, we screen them for high risk In case they have other ailments or sicknesses, we even refer them to care points. And we also have postnatal, after delivery, we have postnatal care for them. And we also have a follow-up for those who have enrolled in PMTCT program from a health facility. We follow them in the community, and we may refer them also back to the facility. We also have prevention of malaria, both for the child and the community as a whole. And then we have school health. In school health, we are looking at the schools we have in Uganda and how their environment, whether it is conducive for learning. In that, we look at the structures which are there. Are they not causing injury to the students? We also look at the health of the individual pupils or students in that area. We also want to see, are they dewormed? Periodically we deworm them. And also we look at the proper disposal of waste, because it also can cause diseases if waste is not disposed properly. Say sewage, the rubbish pits, how are they keeping them? Are they safely disposed? And then we look at the side of family planning. Family planning is not only giving methods of family planning, but it is informing people about how family planning relates to the general population and how they can make their own decisions to how many children they want and how, whether it is good for the health of the mother, and then also as a family. So we sensitize the population about the growth and its consequences. Then we also have a core of home visiting. We home visit to individuals, to families, to the community, and we start with the community diagnosis. How is that community? What are the common things which disturb the community? What are the diseases which may be in that area? This core of home visiting, when we go there, we do growth promotion for the under 5s. We do counseling for mothers and their families, or even if a man himself has an issue, we counsel them according to that. Say, if it was smoking, we could counsel him about it because it affects his health. And we also do what we call contact tracing. Say, for tuberculosis patients, they may be in the community, but because if they don't go for their treatment, they may be a problem to the community. So we identify them and we liaise with them throughout the time when they are having their treatment. Then we follow up on PMT's prevention of mother-to-child transmission of HIV, and we also look at the children who may be malnourished in the community. So all that is a specialized area for this public health nurse. We advocate for or raise awareness for the community to know that they should remain healthy and have healthy behaviors, like quitting smoking, quitting alcohol or reducing it, stopping malnutrition or eating a balanced diet, regular checkups, exercise, and they should be aware of the population explosion.
Now also to engage Grace. Tell us what has changed in the public health sector and what are some of the challenges that are being faced?
Okay, one thing, thank you so much, moderator. I'm also glad to be here and have an opportunity to speak about public health nursing. It's a very modest nursing and specialized, as they have said, my colleagues have said, that it is unique in such a way that this person functions both at the facility as well as the community. So she's really the link between the facility and the community. So, as my colleague has talked about these activities, you see that the activities are basically in the communities. So there are quite a number of challenges that we are having. This particular group of public health nursing is being confused, and so you find that when we talk about public health, then people go for public health basic. And yet, this is public health nursing, which is a specialized area. And so you find some of the appointments now are being done for people who are with public health alone. And then they miss out the nursing part, which is critical. So we look at the training itself. The output that we have is very low now. That is the challenge that has come. It's very low, even to achieve what even the health strategic plan, human strategic plan for the Ministry of Health needs between 2020 and 2030. We should have had 3,712 public health nurses. But the rate at which we are producing them is very little. There are many reasons why cited for low admissions. One of them is because for you to become a public health nurse, it needed you to have had 3 years of general nursing, then you do midwifery 18 months, then you come to public health nursing for 1 year. That makes that. So, but all of them are at diploma level. So, the incoming people who would want, the candidates who would want to come, are tired of diplomas, what we call the diploma fatigue, syndrome fatigue. And so, that discourages people from coming. The other two legs of nursing, which is midwifery and nursing, they have all advanced to bachelors in those areas, and then they even go up to masters. But the leg of public health nursing is still at diploma level. So currently it is advanced diploma. So you find people are not feeling so good to come now for another diploma. So you find that now the output is very low. So another thing that is being said is the modality of training. If the training could change in such a way that there are more different approaches, then it would be more feasible for them to come so that they are able to work and also look after their families. Then the scheme of, if you look at public service, it advertises for people to occupy places like at the commissioner's level. They want you to have either bachelor's in public health nursing, or you can have a master's in public health nursing. But those courses are not available in this country. So where do we find people to occupy those areas? So that's why we are saying the gap is, can we proceed with a scheme of, with the curriculum which is outlining the career path, so that people now can come and they know that they can advance. So those are majorly the areas. Then also at the district, local, and what have you, the Ministry of Health and the Ministry of Education need to discuss with the local government to see how many slots these public health nurses can have. Because if we are going to achieve the Millennium Goals, Sustainable Millennium Goals, and also more so now, the Paris Development Model, we need people who are public health nurses origin to work with those committees. So that's why we say public health nursing is specialized, but it is also critical. If we know that majority of our conditions are preventable, imagine 75% of conditions are preventable. And who is in the community? Right now we have VHTs, but the VHTs are not professional. So it's the public health nurse who should train, who should also supervise these people who provide. She should coordinate those activities down there. Then we can have an impact. Otherwise, we are still forgetting where the conditions are coming from, where this person is placed. So those are majorly some of. And then we also don't have the public tutors with public health background is limited, and so the output is really a problem.
Thank you very much for coming on to the show. It was nice having you. There's a lot of information there to learn about.
Thank you.
Okay. All right, so as we get to interact with the different personalities here, we get to realize that the public health nursing sector is a sector that very many people do not understand or do not have much information about. And we get to realize that the public health nurses have a very big role. They get to our communities, they get to talk to us, they get to teach us certain things we're supposed to be doing, certain foods we are supposed to be eating, how to keep our hygiene clean, and so much more. But there is still so much we are going to learn. Stay tuned. I may have dressed up as a nurse, but I'm not one. It's because I am at the Public Health Nursing College, and we are still exploring the heights of this institution. And right now here, I'm in the class where the demonstration activities for the public health nursing takes place. But before I could get to engage some of the students, let's have one of the tutors, Eogil Consolata, tell us what exactly happens here. Welcome, Eogil.
Thank you.
Take us through what happens in this classroom.
In Public Health Nurses College, as a public health nurse tutor, we take students through the following activities. We do health education practicum. We do practicals in nutrition. We practice in assessment of the community to identify community problems. And we also visit schools to identify issues in the schools. Both primary and secondary schools are visited. We teach students to assess the communities in order to promote health, prevent diseases, and refer those who cannot be handled within their hands. And they also show students on how to protect themselves in case of disaster. For example, Ebola, COVID, and they are in the community. They are supposed also to teach the community how to use protective gears like masks. Sometimes when they get accidents, they should put on gloves before they handle the victims. We also show mothers how they cook their food and how the food is served. And in home environment, we teach them how to segregate waste. They should have those that are used as manure, and those which can't decompose are taken for recycling. We also carry immunization in our home visits when we get missed opportunities.
Okay, now that we know what happens in the demonstration room or this classroom right here, let's have Daphne Masaba take us through her activity.
Thank you. As she has said, this activity is nutrition. And nutrition concerns a mother and a child. And here, when we are training the public health nurses, we teach them to prevent malnutrition when they go to the community. So, as somebody said, that a mother's education, knowledge, her own economic standing, and success inputs in future of generation should bring up. So her education, her knowledge will assist the child to be brought up when he's healthy, and that means a healthy nation. So we teach them diet therapy, and we also teach them how to make some projects like mushrooming, gardening, so that when they go to the community, they teach the mothers. The mothers don't get stranded, and they start at least to feed their children. Here, I have got a collection of foods from Uganda, all over Uganda. And if you want a healthy child, nutrition starts from pre-conception, pregnancy, then you will have a healthy baby. Because this mother has to eat properly, despite the conditions that are prevailing. And that is where a public health nurse, a male public health nurse, is very essential. Why? For male involvement. Because my others don't care. But this male nurse, public health nurse, will go and talk to the men to involve them so that they support the women and the children to feed on well. So, from 6 months, we know all that the baby takes on a breast milk. But from 6 months, a baby has to take family food. And there are signs we observe. You don't just run to the baby and say, you eat. The baby must be 6 months. The baby takes interest in food. Sometimes even can grab the mother's hand and put the food in the mouth. And sometimes they have 2 teeth. And at times, he's sitting stably on the ground so that baby is fit to eat the food. So, we use the foods. The food must be available, affordable to the mother, and also acceptable. If it's not acceptable, the mother will not cook it. And sustainability. Because what brings problems in the home is sustainability. The father left very little mother, little money, and goes away. Then this mother may not be able to buy the food. But here I've got foodstuffs that are in this country, common in this country. And when a mother is preparing to start feeding her baby, she must get equipment for the baby. She must get a tiffin, this one. This one is food security. Even if the in-laws came, if the food is here for John, they will not really cry for this food. It will be for the baby. She has some baby's cup, baby's plate, baby's spoon, separate for the baby only. So, the foods we have today, I have arranged them accordingly. The right hand is stronger than left hand, isn't it? The foods you see here on my right hand, they have more value than the others. So, I have fish, dry and fresh. I have mukene, which is very good. This is whole fish. And the processed one is there. I have meat and milk. I have also the granuts. I have beans. I have rapena. This is from Gulu. So we want everybody to eat the food. Every public health nurse to know how to use rapena. In case the mother has only rapena, she must know how to use it. Then we have got the cereals, rice, millet, and that one is maize flour, unpolished, direct they call it. Then these are the usual foods we have here, and we have got also a line of fruits and vegetables. Vegetables, this one is very common, and nobody sells it, so the mother can prepare for the baby. Buga, and then Susa. When the rain comes, it germinates everywhere, even dodo. So those are the foods. Now, every item that the baby eats must be measured. Okay? For example, the meat. A feast like this one is enough for the baby. And how does the mother prepare it? I will go. The mother gets her sharp knife and she scrapes like that until this meat will be finished. And you get this fine stuff here. Surely, a baby without teeth will eat this meat, no matter what it is. So, that is how we prepare the meat.
And how is the baby's meat prepared when cooking? Like, what are the ingredients you put in the baby's meat when preparing?
We use two proteins, one animal, one plant, one carbohydrate, and vitamins.
So it's like a mixture?
Yes, it's a mixture. So, they call it kitobero, but I don't want to say kitobero because once you say it is kitobero, they think it is for malnourished children. Yet, diet therapy prevents malnutrition and it treats malnutrition. Okay? So, for the fish, if it's dry fish, you have to take a palm like that. That is enough for the baby. If it is dry fish, one side is enough. If it is fresh fish, you use both sides. If it is mukene, you use just 2 teaspoons. They're enough for the baby for dinner and lunch. Okay? And for groundnuts, you take a palm like that. Pound it in the mortar and mix either in fish, mukene, or meat.
That's
for the
like
baby.
Nut paste.
Angie?
Like nut paste. You paste it.
Yes.
Okay.
So the same applies to this one. All those. Now we have OD, or granite paste. That one is used for porridge because mothers in the north and east, they have plenty, and a baby taking porridge without any protein is not good. So we use it for porridge. When we are measuring anything, a cereal, yes, a cereal, this is how we measure it. 2 palms are enough. If whether rice or what, enough for lunch and dinner. Pumpkin, the mother has only a pumpkin. That much is enough. Palm like that, it's enough for dinner and lunch. These are enough for dinner and lunch. Cassava, we take the circumference, but this one is big. So if it's bigger, you have to cut according to your palm. For potato, you take the circumference still, and you take the length. Now, if I were to cook this one for the baby, I would make only that length. Then for Irish, those are enough that can fit into my palm. Pawpaw, you just cut enough. Depending on the baby's age, we also measure these bananas. If the baby is just starting, 1 can be enough, but as it goes along, 3 are enough. Orange, we also measure it. Mango, we measure. If it's big, take just a half. Avocado, same thing, you do like that. And a tomato, this is enough. So, greens, I will use 1 because the measurement is the same. You take just this ring, like this. Anything that fits into that ring is enough for the baby. Pick the soft parts and then put in a banana leaf and steam it. So, what do we do? Here, this is millet. The baby of 6 months eats millet. This one is you can see, it's meat, the scraped meat. It looks like frothy, plus matoke and beans. They are all properly done. Then here we have sweet potato with groundnuts and dry fish. Here I have cassava. When the mother has cassava only, the baby can have it as a meal. So this is maize meal plus mukene and groundnuts. This is how it looks like. So the baby must eat 5 times a day. Must have breakfast, mid-morning snack, must have lunch, must have evening snack, and then eat dinner. And here we caution the mother that the baby's eating time must be constant. Otherwise, you will forget. And then, if the mother is going to feed the baby should be fed before they eat family food. Otherwise, the baby will refuse this one and prefer what the mother is eating. So you must give it before the family food.
So for one to be healthy or to stay healthy, that means you have to eat healthy food. And as we have seen in the nutrition section, Daphne has taken us through some of the foods a mother and a baby can eat in order for them to stay healthy. And that includes the fruits, the greens, the cereals, fish, meat, milk, and so much more. Now from the nutrition section, we are going to the immunization section to see what they have for us. And here in the immunization section, we have Kiamigisha Aniset, Nyeroto Francis, and we also have Atuhura Jacqueline, who are going to take us through the immunization.
Thank you very much. My name is Kamugisha Aniset. I'm here on immunization station, and in immunization we normally do many things because as a public health nurse, I do believe that immunization is the key in disease control and prevention. We normally do gross monitoring, whereby we weigh children, we find out how many kilograms the children have in terms of the way how they are growing, considered to age. Another thing we do nutrition assessment, whereby we take the middle upper arm circumference of the arm of the child, and that one will help us to know how the child is improving in terms of nutrition. Immunization is a key thing in disease prevention because most of the diseases are immunizable. And I do believe that when all diseases are immunizable, we have very few cases in the hospitals. And it is very important to prevent them before people get diseases. And among the immunizable diseases, we have polio, we have TB, we have diphtheria, we have measles, rubella, we have rotavirus, we have hepatitis B, Haemophilus influenza type B, tetanus. Then we also do prevent human papillomavirus, then meningitis and pneumonia. And our station is here. What we have said here, it is the same which is done in hospitals and in the communities. Immunization is not only done in health facilities, we also go to communities and we do immunization outreaches. And what we do in the hospital is the same that we do in immunization when we go to communities, because sometimes you find some of the mothers are unable to reach our health facilities and their children miss immunization. So it is our role as the public health nurses to prevent diseases to every person. We make sure we go to villages and we find out those people who didn't get a chance of coming to hospitals, and they also get all the services of immunization.
Okay, thank you very much, Anset, for having taken us through immunization. So let us come and look at the records. Since you have mentioned about the weighing of the child, at what age a child should be immunized, we need to keep this record very well. This one help us for follow-up. So these records, when we are getting a vaccine from the national store, we need to have the record of this vaccine, and this record also help us how much vaccine a district or a health facility need to be taken to the facility. It also help us to calculate the coverage, how many children under 5 which need to be vaccinated in an area. So this one also determine how much we are going to get the vaccine. And also, this record also help us in what? In the planning. Because if you don't know the number of people you are going to serve, it will be very difficult for you to plan for them.
All right, now from the immunization section, we are going to the next activity, which is infection prevention and control.
I'm Waswa Andrew, a nurse. So waste segregation is both at the community and in the hospital setting. Well, so in the hospital setting, here it's by color coding, and we put the sharps in the safety box. Those are the used syringes, and in the black container, it's where we put the empty bottles, food peelings, and also that other food. In the yellow container, it's where we put the infectious wastes. That can be the used cotton swabs, used gloves, and in the red, it's where we put the highly infectious wastes, and this can include used blood giving sets. The brown one, it's where we put the pharmaceutical products, and those are the ampules and the vials. So waste segregation is both at the community and in the hospital setting.
So there has been an outbreak of Ebola, and that means we have to be conscious about the people we engage with, what we do, and some of the signs and symptoms. And that brings us to the next section, which is the disease prevention. And these nurses are going to talk to us more about Ebola. And we have Ndikolachi Fred and Chemtai Eric.
I'm called Chemtai Eric Abraham. Still, I'm going to talk about epidemics. One, when the community comes across any of these epidemics, the facility is the primary place to be informed, and these are the health centers. So when they encounter these things like Ebola, like Marburg, COVID, the health center is the first place to be contacted. And what do we do as the health center? One, we arrange transport for these clients so that we avoid transmission within the community. Two, we isolate these patients immediately as they reach the facility. Why do we have to isolate? It is because we are still preventing the transmission of the disease. Then three, this is important, we have to test these people. Now that we can see the signs that the public health nurses have been aware in the community about, we cannot just base on that this is the truth. We have to test. We get the sample, we take it to the lab, it will be tested, then when the results come back, then it will be analyzed. The first thing is the management. This is the treatment. When the results come back, then the health team, the doctors, the nurses, the lab, all the departments come together with the patient and their attendants to identify the best treatment to be given to this patient. And then from there, we continue with the contact tracing. We have seen that this patient came from the community. He had been living with some people. So there are some people whom they have been interacting with. We again follow up on this patient to find out if there are some people to whom they had been interacting with. On the other side, what are the signs and symptoms that we have to do when we are contact tracing? One is the high temperatures. Two, if someone has headache. Three, abdominal pain. Four, if someone has like unexplained body bleeding, like from the nose, the eyes, and then the anus all along.
Right, we have seen some of the activities in the disease prevention section, and some of the symptoms of Ebola are abdominal pain, fever, headache, and bleeding from the body openings. And if you have some of these symptoms, you could run to some of the nearest clinics. Now from that section, we are going to the next activity, which is the school health activities, and that is Komegisha Resti and Nabakoza Katongole, who are going to take us through this activity.
Thank you so much. As public health nurses, we do a school health program, which is one of our roles. And in school health activities, we do health education. We teach these pupils personal hygiene, how to clean their teeth, their ears, their underpants, and to bathe the whole body. Yes, we also do screening for minor ailments or minor illnesses, which include ear diseases, eye diseases, skin infections, and the rest. We also do referrals for those whom we cannot manage to the people at the health stations. And that's why we work as a team. We cannot do these activities alone. We also do nutrition. In nutrition, we ensure every school has a school garden, and then we emphasize that the school prepares a meal for every child so that they can have their learning properly.
I want to add on what my colleague has said, that in school health, still there is immunization. As nurses and midwives, we do outreaches in the schools. We all know that school comprises of nursery, primary, secondary, and sometimes the children of below 5 years go to school. So we check to see whether they have finished their immunization schedule, and we try to follow up. We continue giving the dewormers to the children all up to P7 and up to other classes. But most of the children of 5 years, we ensure that they are being dewormed and they are given their vitamins. And we also ensure vaccination of girls. From the age of 9, we ensure that they are vaccinated against the cervical cancer, that is the HPV vaccine. And we also continue with the tetanus vaccine so that they are protected. And we ensure them to take the information to their parents and to the community at large.
All right, so from the school health activities, let's have Nalwoga Juliet, Namwanje Nabira, and Namukuta Dina to take us through the home visit activity.
Thank you, presenter. My name is Naroga Juliet Matilda, a public health nurse student. In home visit is the core role of every public health nurse, and that's what differentiates us from other nursing cadres like nurses, midwives. But we work hand in hand with them to see that our community is healthy and stable. When we are doing this home visiting, we reach out our clients in their homes and we see how they live in their homes to see what to do, what to add on through health education. We educate them on their nutrition, the family planning. There we talk a lot when we reach there to show them the value of family planning due to this rapid increasing population. And in home visiting, we also assess their homes to see, do they have toilets? Do they have kitchen? Is the compound clean? Is the house well built? How many are they staying there? How many are they living that home? So we look at all that, at their environment in general, and we also screen these clients of ours when we reach there. We screen them to identify illnesses in them. And the minor ones we manage from there as public health nurses. The ones which are complicated, we refer to healthy facilities. And in health facilities, they'll find these colleagues of ours. So that makes us to work hand in hand with them at every stage. We also give advice to people who have chronic cases in their communities on how they are supposed to live, how they are supposed to handle their conditions. There are people who are handicapped in families that cannot reach the health facilities. So we manage them from there. For the conditions we can manage. The ones we cannot manage, of course, we refer. We also do immunization, as it has been said, and we also do counseling. It is part of us to do counseling because we find those mothers depressed. And also in home visit, we identify things which cannot be identified in healthy facilities, like domestic violence, drug addicts, and we manage and refer. That is our work. So that makes us, we public health nurses, to be a link between the health facilities and the community.
So as we were showcasing the activities in the classroom, you must have noticed the different colors of uniforms. Like the one I'm putting on is for diploma in nursing, and then the deep blue is for advanced diploma in public health nursing. And then we have the one with the white belt, which is a diploma in midwifery. And we got to realize at the Public Health Nursing College, there are different activities that the nurses here practice, including nutrition, immunization, disease prevention, and home visiting, which of course makes it unique from other sectors. Well, if you have learned a thing or two, that is a good thing. But that is all we had on the Education Forum today. Bye.